The Midwifery Workforce Study was a 2-year project funded by the Johnson & Johnson Foundation. And the purpose was to provide tools and information for our affiliates to do advocacy at the state level. So we used publicly available data from the CDC and other sources, along with the information from the American Midwifery Certification Board. So that's every midwife who has a certified nurse midwife or a certified midwife certification. So over a 5-year recertification cycle, we had access to data that allowed us to find the demographics of midwives and where midwives practice, and what is the relationship between midwifery law and the density of midwives in a given state, and where in the state are midwives located. And we just gathered as much information as we could that would be useful for our states to address some of the barriers. So some of the areas where we looked at: do midwives have independent licensure so that they can practice without a written practice agreement with a physician? Do they have independent prescribing? Do midwives receive parity in Medicaid reimbursement, meaning a physician is reimbursed X? Does a midwife get a percentage of that, or are midwives reimbursed the same way physicians are? Does the state allow for or even protect midwives' access to hospital privileges? If you can't get hospital privileges, you're really out of luck, and so are the pregnant people in your community, because most people give birth in the hospital. Another area for opportunity is, our certified midwives licensed in your state? Or have you already licensed certified midwives? Because we're not licensed in all 50 states the way certified nurse midwives are. We gathered data because we're interested in the data, and there are organizations using our data, which is terrific. But the real purpose was to enable our midwives at the state level to create the best practice environment for certified nurse midwives and certified midwives. We developed state fact sheets that have opportunities and assets to guide midwives at the state level for where they can narrowly target areas of improvement. We produced a national Chartbook to give information on the national scale about the midwifery workforce, including entry to midwifery, so information from faculty and students and midwifery education programs about barriers to entry to midwifery. We also included information about attrition from midwifery and why people leave the profession. We produced the state fact sheets to help the state affiliates advocate for what they need, but then we created an advocacy toolkit, which is a step-by-step, very detailed guide to how to do advocacy and make changes within your state. So that is what we hope anybody interested in advocating for expanding the midwifery workforce or expanding the scope of practice or ability to practice relies on: looking at this toolkit and using it to make some change.